guys, Caitlin and Brad coming to you again from the Foot Lab in White Bear Lake, Minnesota. We're here today to talk to you about plantar fasciitis, and it's a specific issue, pain in the heel, and we see it all the time with our clients. Brad's going to take us through a little bit of what it is, how it happens, and how to fix it.
Good, sounds good. Thanks, Kate. So plantar fasciitis, what it is the plantar fascia ligament, which is on the bottom of the foot here, is responsible for creating the arch in the foot. It's attached at the forefoot and it's attached back here at the heel. And plantar fasciitis is when that ligament is pulled away from the heel, we get little micro tears between the ligament and the heel, and the pain that you're feeling is that ligament tearing away. So the next question is, why does it happen? There's a couple reasons for why it happens, and first of all, the biggest reason is probably the stability of the foot. We talk about in Orthotics about the gait cycle, and the gait cycle is what happens in your foot between toe off, swing phase, heel strike, and then toe off again. And when your foot is not stable and you have a foot that pronates, or in other words, it rolls inward like that, what happens is when it rolls inward, it lengthens and it stretches this ligament. Now this ligament here is about as stretchy as steel, meaning it doesn't stretch. So something is going to give, and eventually what gives is this tearing at the back at the heel. The second reason why it happens is because of the calf muscle. The gastrocnemius muscle group up into here comes down into the Achilles tendon, which attaches also at the back of the heel. When this calf muscle is too tight, what happens is it pulls up on the heel, which has the same effect as pulling and tearing away at the plantar fascia ligament here. So we really have two problems. We have an unstable foot and we have a tight calf muscle. So the way we fix it, or how to fix it, is to first of all stabilize the foot. That's kind of the root issue in this whole thing, and until we get that resolved, people tend to deal with the symptoms of plantar fasciitis rather than the root issue. So getting that fixed involves a custom orthotic. So the biggest problem, or the biggest mistake I think we see in our clinic here, is that people will come in having tried all sorts of the wrong solutions. And that means everything from trying an over-the-counter insert like Dr. Scholl's or Superfeed or some of those types of things. Well, those are great solutions for support prior to injury. Once you get to injury, you're really across that line. You've passed that line. And a custom orthotic is a unique prescription for your particular foot. Your human foot is as unique to you as your fingerprints are, and it's not possible to go to the drugstore and buy an over-the-counter solution for your foot. So creating a custom orthotic solves the root issue of why is this happening. So the second thing that we need to do now is address the pain, the symptom rather, of the plantar fasciitis issue. So we're going to do that by using a strap mechanism that we'll show you here. But a little bit of a backstory on that. One of the things that Caitlin and I have to do every year is go to our national convention and keep our continuing education credits up. And I remember going there one year and spending an entire day on plantar fasciitis. And the research that was done on that is that this muscle group, it contributes a lot to the plantar fascia problem. And the biggest issue that we talked about, or that this researcher talked about, was how strong that muscle group is and what kind of effort it takes to lengthen that muscle group and relieve the pressure on the back of the heel. So the guy that was doing this was a sports medicine doc, and he had created a brace that would lock out the knee and that would pull back on the foot, gently pull back on the foot, and over time it would increase that range of motion at that joint. So this brace is $750, and I'm Norwegian enough to be thinking, what other options are there for this? So we kind of poked around, and the other side of our business sells kayaks, and we have roof rack straps, and we've kind of come up with a way to very inexpensively do the same thing that this brace does. The biggest takeaway that I had from this presentation is how long it takes to stretch that muscle. And this guy's recommendation was that it takes an hour a day of stretching that calf muscle in order to have any kind of a change. Now, I've gone through symptoms of plantar fasciitis myself, and I did do this, and it did work for me. And what I did was break that hour up into small segments. So I could be using this brace during dinner, or when I'm sitting at my desk, or when I'm watching Survivor on TV, or whatever's going on. I could find an hour of time to do that. And this is something that doesn't take hours, it takes weeks. The second thing about that is that we want to make sure that we're not over tightening this strap, and we'll show you how this strap is going to be adjusted here in just a second. So the two takeaways are over-the-counter stuff. Once you develop plantar fasciitis, over-the-counter stuff is not an option. It just is not working. And second of all, we need to embrace this stretching mechanism as well as the custom orthotic to get this resolved. It's very fixable. It's frustrating for us to see people put up with this when they don't have to. It's a simple fix. It's a mechanical issue, and we can solve that issue. For the strap therapy, what we're going to do is take the cargo strap, put it over us, and wrap it around our hips. We're going to sit down, put the foot into the sling part there, and if you notice before we do any adjustment, her foot is at about a 90-degree angle to the shaft of her leg. And what we're looking for here is a 10-degree flex. So as she starts to pull back on that strap, she's going to move the foot back into this flexion. Now, the important thing here is that when you're first starting out, you don't want to go hard on this. It should be comfortable tension. This is not one of those things where if a little is good, more is better. We want to ease into this, and when you get done doing this for an hour, you shouldn't have any discomfort or pain. It should just be gentle tension.
If you guys want to make an appointment, again, just call the shop or go on www.thefootlab.com and you can self-schedule an appointment there. It takes about an hour. Bring a book to read while we're building and a couple pair of your shoes. No need for a referral from a physician, but it's smart, something you want to get on top of as soon as possible. So we look forward to seeing you.